Good morning, good afternoon, and good evening. Welcome to the 914th day of continuous and uninterrupted Zoom session of Ifph. Let us have a silent prayer for 1 minute. Thank you. Today we have with us Dr. Chaitra G. AVINASH, BHMS, MS, CNP, PGDHHM. He is a passionate homeopathist with over 15 years of experience. Completed her BHMS from Government Homeopathy Medical College and Hospital, affiliated Rajiv Gandhi University of Health Sciences, Bangalore, with honors. Later pursued in a master's in counseling and psychotherapy. Has also done postgraduate diploma in hospital and healthcare management. He did 2 years practice as a homeopathic medical officer from 2008 to 2010 in Government District Hospital, Davangere, Karnataka, India, soon after her graduation. Then began private practice from 2010 till date. Being a doctor and healer of homeopathy, has a vast experience in treating various chronic and acute diseases and has presented papers in various health portals and continued education programs and conducted television shows on healthcare. Also worked with people who find out why they are ill in the first place and then clearing the blocks and obstacles to optimal health and vitality. The topic is homeopathic approach in trichology. It is quite sound and important. So on behalf of IFPH, I am welcoming you, doctor. You can have the platform for the next 45 minutes. It's over to you.
Thank you, sir. Thank you, Dr. Manoj. Yes, sir. I'm audible, right, sir?
Yes, no problem.
Yeah. Okay, sir. Thank you so much for the introduction, sir. So today the subject is homeopathic approach in trichology. So as sir gave introduction, like I'm Dr. Chaitra AVINASH. I completed my BHMS from Government Homeopathic Medical College, Bangalore. So I have put up practice, like 15 years of practice in Bangalore and in Davangere. Currently, I'm residing in Davangere, Karnataka. So I would like to thank Dr. Manoj sir and Dr. Danesh sir for inviting me here and all the members of IFPH for giving me this opportunity to present this paper. And I would also like to thank all the audience in advance. So let us dwell into the subject. So like what is trichology first? As we all know, trichology is a Greek derivative. Tricho means hair, logy means study. So the scientific study of hair and scalp is known as trichology. So the specialist which deals or who studies or who performs this hair and scalp studies is known as trichologist. So why is it very important? Like hair and scalp is like very like external part, right? It is nothing. The problem in hair or scalp is not damaging or is not life-threatening, like as much as compared to other diseases. In spite of that, why we need to deal with these disorders? Why do we need to study trichology? It is because hair is the crowning or the appealing beauty for any person. So not only in cosmetic reasons, like coming to health reasons and coming to psychological reasons, like virility, like self-confidence, self-esteem, like hair gives a lot of importance in an individual personality. So when there is any minute changes in the hair and scalp, like skin is the outermost organ in human body, and any changes in the body, health changes that happens can be detected externally through the hair and scalp. So it is the first alarm of your body, like when there is any changes. So when you take care of your health, when there is any deterioration of health in your hair and scalp, so it is like a prevention. Hair and scalp plays an important role, especially in this psychotic world, especially in this generation. Like there is a lot of industries, lot of cosmetology industry, lot of trichology industry, which is booming today. So that is because a lot of importance is given to hair and scalp. Especially when we combine the knowledge of trichology in homeopathy, we can create miracles. How is that? There is a lot of other surgical procedures, right? Like PRP, derma roll, mesotherapy, hair plantation. We know everything about that. In spite of that, why is homeopathy important in this field? So for the next 45 minutes, we will study about this. So when a patient enters into our clinic, the first thing is observation. When he walks into our clinic, we all know the case taking starts from there. So how he walks into the clinic, so how is his attributes, how he sits in the clinic, How is his appearance? When it comes to the hair and scalp, it is very important to notice his hair. So what is the quality of his hair? Is it healthy? What is the color of the hair? What is the texture of the hair? Like, is it wavy? Is it straight? Like, what is the strength of the hair? Is it thick? Is it thin? So what is the appearance of the scalp? Like, is it dry? Is it moist? Any eruptions, like any dandruff? So examination of scalp is very important. For example, before starting or going into the subject, I'll give an example. So when the patient walks into the clinic with very thinnest of the hair, like we cannot arrive into totality with one symptom itself, but if we know these things, we can arrive at the totality or we can arrive at the constitutional simillimum. So it helps us in deciding what is the best medicine for our patient, right? So when the patient walks into your clinic with a very thin, very coarse hair, so what is the medicine we decide upon? Any guesses? Soranum. Soranum is the patient who has a very thinnest hair. There is no luster in his hair, right? So there is another patient walks into your clinic. So the head is very curly. There is tendency of becoming curly or wavy very soon. As soon as it takes head bath, the hair will be straight. You leave it for 1 second, it wells back to curly nature. So what is the medicine? Mesotherium. So next, the patient comes to your clinic, he has combed his hair just now. In spite of that, it looks so unhealthy. It looks as if it is matted and he's not combed his hair for around a month or so. So what medicine can we arrive at these situations? So when the hair, in spite of combing, it is not smooth, it is matted, we can think upon medicines like borax. So there is a patient, he comes to your clinic, there is a lot of hair on the androgen dominated parts like chin, upper lip. So we all know it is hirsutism. We can think of Oleum jacqueris. So next, a patient comes with very untidy hair, the untidiest hair. Like we all know when there is any psychological illnesses in a patient or when they leave the hair for religious purposes. We know a lot of yogis, right? The hair is so much matted. There is a lot of tangling in the hair. There is a lot of twisted, which is irregularly twisted, and the hair looks as if a mass of cement is on the head. We call it as acute hair matting. Medically, we call it as plica polonica. So when a patient with such a type of matting comes to your clinic, so we need to evaluate whether he is psychologically stable or is there any religious purpose which is involved in this. So we can arrive at medicines like vinca minor when there is plica polonica. These are like pointers. So in homeopathy, like we need to consider the totality of symptoms, but these pointers helps us in arriving at the constitutional simillimum, right? So like we'll move into our slides. So what is the agendas of today's study? So we will know about introduction, structure, life cycle. We'll know about hair disorders, classification of alopecia, types of alopecia, classification and types of alopecia, repertorial analysis, miasmatic approach. We'll also have case discussion. And last, but very important, diet and lifestyle modifications, right? So you give on your drugs, there is vitamin B12 deficiency, there is ferritin deficiency, there is iron deficiency, there is mineral deficiency. We need to correct this, right? So hair fall happens because of a lot of reasons, not only genetic, not only age related, it happens because of medical reasons like PCOD, thyroid, which we see, which is very common nowadays. It might also happen because of acute illnesses. It might also happen because of lack of good nutritious diet.
Excuse me, doctor. Excuse
yes,
me.
Yes, sir.
I think this will take a long time so that you can split
yes, sir.
Today's topic into 2
yes,
days sessions. No need of hurry. Okay.
Okay.
Very important one. Okay. Yes.
Yes, sir. Yes, sir. I will go into the, like, we all know the introduction, like we know what is hair, like it is a pigment, filament, keratin, which grows from the follicle, right? Hair is nothing but protein. It is made up of keratin. All the mammals, all the humans, they have external covering as hair. And as I told you, it is called trichology. So why is hair very important? Apart from protection and apart from facilitation of evaporation, that is perspiration, it acts as a dry lubricant in important areas, which creates friction. It also acts as barrier to foreign particles. This is like very anatomical. We all know this. This is very simple. Even if it is very simple, when a patient comes to your clinic and we cannot cure his hair loss, it creates a lot of sadness in us, right? So it is a very minor ailment. In spite of that, like we should be very perfect in treating them. So the study of trichology is very important. We need to know what is normal, what is abnormal. So for example, a person with premature hair graying comes to you, like he is at the 50s. Like we cannot tell him we are going to cure your graying at the age of 50, right? Because it is according to the aging process. It is according to the nature. We can give them assurance that we can slow down the process with diet and our medications. We should not give false assurance. So we should know what is normal and what is abnormal. So before the age of 30, whatever graying happens, we call it premature hair graying. After the age of 30, if any patient after the age of 30 comes to you, please do not give false assurance. So we need to know what is normal and what is abnormal. So coming to the hair structure, it is mainly divided into 3 parts. One is the hair root, which contains the hair bulb. So there, the pigment producing content, that is melanin, is present in the hair bulb. Next is the hair root. So hair root, as it's attached sebaceous glands, apocrine sweat glands, which produces sebum, so which is essential for the lubrication of the hair. So next is the hair shaft. Hair shaft is the thing what we see outside our hair and scalp, right? So it is the proteinaceous content which is made out of keratin. It is a dead tissue. Keratin, that is the hair what we see outside, is a dead tissue. So what is normal? How much of hair do we have on our scalp? So at an average, we have around 1 lakh to 1,50,000 hair follicles in our scalp. So losing 100 to 150 strands of hair is very normal. So if a person comes to you and he panics, I'm losing hair. So you can ask like roundabout, what is the, like nobody counts it, but at an average. So losing 100 to 150 strands of in a day for an average adult is very normal. So whatever you lose above 150, approximately, we call it as an abnormal hair loss, and medically we call it as alopecia, right? So coming to the next slide, hair life cycle is very important because we need to know what is, as I told you, what is normal and what is not normal. For example, in postpartum, like after delivery, a female comes to you and complains of hair loss, which is very common. So whatever hair loss happens from 1st month or 3rd month to 8 to 9 months of pregnancy is normal. That is because of the hormonal changes which happens in her body. So supplementation with necessary vitamins or our biochems and good diet is enough for her. If the hair fall is persisting, if the hair thinning is persisting, even after 8 or 9 months of her pregnancy, then we can put her on medication. So we need to know what is normal. For that, we need to know what is hair life cycle. So as I told you, hair is made up of keratin. Around 1,50,000 hair are present on the hair, and losing 100 to 150 hair follicles is normal. So there are 3 stages of hair life cycle. The first stage is anagen stage. That is the growth stage of hair. So you will have this growth stage for 2 to 8 years. So 85% of our hair is in anagen phase, that is in the growth phase. So 85% of our hair today is growing. So after the growth phase for around 2 to 8 years, it depends upon the genes. If you have a strong genes, if your lifestyle habits is happening properly, like no stress, like little amount of stress is good, eustress is there. But if there is distress, so this 8-year cycle can come down to 2 years. So next is the catagen phase, that is the resting phase of hair, where our hair rests for 15 days, around 2 to 4 weeks. So around 1% of hair is in catagen phase, that is resting phase. So soon after that, they go into telogen phase, that is fall phase. 10% of our hair is in telogen phase, that is which happens around 3 to 9 months. Telogen phase is fall phase. It happens for 3 months. So whatever hair fall is happening today, it is not because of the cause which was yesterday. It was because of the cause that has happened around 3 to 9 months before, right? So minimum 3 months, whatever stressors has happened 3 months before, because of that, today we are experiencing the hair fall, because telogen or the fall phase takes 3 months for the hair to start falling. So after this telogen phase, again, the growth phase of the hair, that is the anagen phase, starts. That's the reason I told you, soon after delivery or soon after any illnesses, if there is hair loss, like that usually starts after delivery, usually it starts after 3 months, hair fall, or after acute debilitating illnesses. The hair fall does not happen overnight. It takes around at least minimum 15 days to 1 to 3 months. That is because the telogen phase, that is the fall phase of hair, lasts for this amount of duration. So only 10% of hair you lose in this phase. That is the reason, like if the hair fall exceeds 100 or 150, that is more than 10% of your growth phase, then you need to consult your doctor. So that is the same thing, anagen, catagen, and the telogen phase. So coming to the hair disorders. So what are the hair disorders? So anything which is in less amount also create panic. Anything which is more also create panic in us, right? So if the hair loss is happening, we call it alopecia. If there is excessive growth of hair, we call it hypertrichosis. So hair loss is medically, we call it as alopecia. It is a Greek derivative. So the term alopecia is used dating back to Hippocrates. Like this comes from the scientific word alopex, which means fox. Foxes used to lose their fur because of the fungal infection known as foxmangue. Because of that, the word alopecia has been derived from it. So hair loss is not a symptom. Hair loss is a symptom. It's not a diagnosis, right? So hair loss happens because of other diagnoses, like medical diagnosis, PCOD, thyroid, diabetes, all these things. We'll come to that later. So alopecia involves a range, as I told you, like genetic, endocrine, immune, inflammatory. Most of the hair disorders are not serious, or these are not life-threatening. Excessive hair growth, we call it as hypertrichosis. So hypertrichosis should not be mistaken with hirsutism. Hypertrichosis is a rare and curious condition that causes excessive hair growth anywhere on a person's body. Hypertrichosis is sometimes known as werewolf syndrome. We know wolf, right? The distribution of hair is so much. So hirsutism is commonly mistaken for hypertrichosis. That is 10% of women, they have hair distribution on the androgen dominant parts, especially in hormonal disorders like PCOD, diabetes mellitus, thyroid, which needs to be considered. It is mainly because of hormonal imbalance. So coming to the classification of alopecia, there are two types. One is primary alopecia, another is secondary alopecia. In primary alopecia, there are two types. One is non-scarring. Non-scarring means the follicles are still alive in your scalp. So with medications, with rejuvenation, they come back. Whereas scarred alopecia is where your hair follicles are dead. In spite, like the dead follicles, the rejuvenation is very difficult. So coming to the localized non-scarring alopecia, these are the types: androgenetic alopecia, tinea capitis, ringworm, or it might be traumatic. Traumatic, there are three main causes. Trichotillomania, it is a psychological disorder where the person plucks his own hair. It might be because of traction, that is tight banding of hair through hair bands, or constantly combing the hair, like taking partition in the same direction. All this causes trauma and traction. So cosmetic may be because of chemical treatments like hair straightening, coloring the hair again and again. So scarring alopecia, that is where the hair follicles are almost dead, or they are in dormant phase, latent phase. That might be because of developmental defects. Discoid lupus erythematosus, where we see this in SLE. It might be because of herpes zoster, pseudopelade, lichen planus, folliculitis declavans. We also find in radiotherapy, right? So diffused alopecia is, we find it all over the scalp. So the classification is androgenetic alopecia. I'll explain this. Telogen effluvium, metabolic, hypo or hyperthyroidism, diabetes mellitus, HIV, nutritional deficiency, any liver diseases where metabolism slows down, postpartum, after delivery, alopecia areata, which is an autoimmune disorder. So secondary alopecia, that happens secondary to any of the diseases, systemic diseases, that may be SLE, tinea capitis, lichen planus, syphilis. So coming to the type of alopecia, like involutional alopecia. So you get a patient in your clinic, the man is around 70 years of age. He comes and tells you, I do not have hair, which I had in my puberty. So this is according to the growth phases. You need to counsel the patient. You need to make him understand, sir, like this is a natural condition in which there is thinning gradually happens with hair age. That is, more hair follicles has gone into the resting phase, which is normal. Because of this, anagen or the growth phase has become shorter. So this is involutional alopecia, which happens because of age and which is considered very normal. Androgenetic alopecia. So in our clinics, we get 80% of patients with androgenetic alopecia. So what is androgenetic alopecia? Androgenetic alopecia, only males do not suffer from this. Even females suffer from this alopecia. Androgen meaning like we consider, oh, only males have this. No. females also have androgenetic alopecia. So what happens? So 98% of the male hormone testosterone is bound to a protein which is absolutely safe. Only 2% of hormone testosterone will be freely circulating in your blood. So what happens when you're exposed to some stress or emotional factors or lifestyle habits like diet or sleep is not happening properly? What happens? This 2% of hormone testosterone gets converted into DHT, that is dihydrotestosterone, which is the main culprit of thinning and hair loss. So what happens? This DHT, which is the main culprit, it goes and attacks to your hair bulbs. So there will be thinning of the hair follicles, there will be shortening of the hair follicles. So the hair shaft goes into a process called miniaturization, that is thinning. So when there is permanent thinning of the hair, the person undergoes androgenetic alopecia. So when is this found? This is mainly found in hormonal disorders or genetic, or when the person is exposed to stress. So what are the types of male pattern baldness? So in dietary changes, vitamin deficiency, especially nowadays, we are finding a lot of vitamin B12 deficiency, right? So 2 in 50% persons will definitely have vitamin B deficiency because of the dietary changes which we have made in these days. Coming to the androgenetic alopecia in men, we follow Norwood scale for the diagnosis. There are 6 types of androgenetic alopecia. In the first stage, there is thinning in the frontal area, that is in the temples. Minute thinning is there. So in the second stages, the thinning further recedes in the inverted M shape. So in the third stage, with the involvement of the frontal or temple region, there is involvement of the vertex area. So in the fourth stage, there is furthermore involvement, furthermore thinning of the frontal and vertex area. In the fifth type, complete visibility of the temples and the vertex. So in the sixth type, the follicles would almost have been dead or completely in latent phase. So even in the sixth stage, how do you differentiate this androgenetic alopecia from other hair losses like alopecia areata, alopecia totalis, or alopecia universalis, which happens because of autoimmune conditions? In androgenetic alopecia, even in the advanced stages, nobody is going to lose hair just above the ear or in the back. That is in the occiput region. Nobody lose their hair just above the ear or in the occiput region. That is androgenetic alopecia. Why is that? Because as I told you, DHT, that is the testosterone which gets converted into DHT, the receptors of this DHT is absent just above the ear and in the back. That is the region men intensely do not go bald in those regions. If there is hair loss, if there is hair thinning in that area, it might be because of other reasons like tinea capitis, ringworm, or alopecia areata. Like we'll discuss about that. So when the same pattern of thinning or hair loss happens in women, it is called as female pattern baldness. So there are 3 classifications again. We call it as Ludwig scale to diagnose this. First scale, in the partition area, there is thinning. In the second stage, there is furthermore thinning. Third stage, complete involvement of the frontal and vertex area. So what is alopecia areata? Alopecia areata, it is an autoimmune disorder. There is the loss of hair in patchy pattern, in round patterns, in discoid pattern. This is the most common type of alopecia. So it equally affects men and women. So most frequently it affects the scalp, mustache, beard area. This is typically presents as a discoid patch of alopecia which shows no scaling, no papules, inflammation, or atrophy. If there is scaling, or it might lead to like other diagnoses like seborrhea or psoriasis, scalp psoriasis. If there is papules, if there is inflammation, if there is atrophy, it might be because of ringworm, tinea capitis, pseudopellet, all these reasons. So what is the diagnostic feature of alopecia areata? So when you examine that patches, there is an exclamation mark. So that is the hair shaft will be thick at the roots and it becomes very thin at the tip. At the point, it projects as an exclamation mark. This is the main indication of alopecia areata. Without trichoscopy, if you want to examine the patient in the naked eyes, exclamation mark is very pathognomic symptom of alopecia areata. So what is alopecia totalis? What is autoimmune disorders? As you all know, like your own body recognizes your own cells as a foreign object and it fights against it. So there is a lot of destruction. When the alopecia areata goes to the further stage when it is not treated efficiently. There is complete loss of hair all over the scalp, and this is known as alopecia totalis. So what is alopecia universalis? Not even a single hair is found on the body. So loss of hair from whole body, including the eyebrows, eyelashes, pubic hair. So hair, alopecia areata continues to increase in size. So such cases should be treated immediately. So when coming to the prognosis, homeopathic prognosis, lot of medicines like syphilinum, ustilago have been found useful in these syphilitic cases. So next, what is traction alopecia? As we told you, it is because of friction. It is due to constant or prolonged traction, which is used as tight hairstyles or chemical treatments like dyeing the hair again and again, and other cosmetic treatments like straightening, keratinization, all these things. So what is trichotillomania? So at the end of the session, I'm going to present a case. So it is a psychological, tricho is hair, tillo is pulling, mania is a psychological disorder. It is a psychological disorder in which the person is so much disturbed that he goes to a level of pulling out his own hair and derives pleasure out of it. So telogen effluvium, we should be like, we should have a knowledge of distinguishing telogen effluvium from anagen effluvium, right? So when there is a trauma to our body, for example, after acute illnesses, like we have seen a lot of hair fall after COVID-19, so after viral infections. So this telogen effluvium is a temporary hair thinning over the scalp that occurs because of changes in growth cycle of hair. A large number of hair enters in the resting phase. Growth phases becomes very less, and lot of hair enters into the resting phase, and subsequent thinning and hair shedding happens. So like there are a lot of medicines we have in homeopathy, especially after telogen effluvium, like we can treat it very successfully. We have 90 to 100% success rate in telogen effluvium. So we have many medicines in our repertory, which I'm going to discuss again in the future slides. So what is anagen effluvium? Telogen effluvium happens because the resting phase is exaggerated. A large number of hairs enters into the resting phase. So telogen effluvium happens, whereas anagen effluvium, there is lot of hair in the growth phase, especially the patients after chemotherapy, after radiotherapy, after draining disorders like cancer, after exposure to radiations. There is anagen effluvium. This hair loss is generally caused by chemicals such as those used to treat cancer. So there might be patchy hair loss or there might be diffuse. The good news is that when you stop using these chemicals, the hair normally grow back. That is usually what was the density of your hair, which was 6 months back, the same hair you can get it back. Other drugs can also cause hair loss. Many medicines used to treat even common diseases. This can cause hair loss. We can manage this very efficiently with homeopathy. So coming to the repertorial analysis. So all this was the theoretical part. All of us know about this. So now we'll enter the practical part. So I am audible, right? Yes. Shall I go more faster, sir?
No, it's good.
Yeah. Okay. So coming to the repertorial analysis. So rubrics for hair fall is very important. So where do we find the rubrics for hair fall? In Kent repertory, we need to go under head, falling out hair. So in general, we have 219 medicines which is mentioned for hair fall in Kent repertory. That is falling out hair alopecia. We can see drugs like antimonium crudum, epis, ars, calicel, flacasis, lycopodium, natramur, nitric acid, these things, taphysagria, thuja, thyroidinum, we all would be aware of, right? So in young, there are 3 types of hair again. So when we are present in our mother womb, the distribution of our hair will be known as lunago. Lunago is the hair which is fine, thin, coarse hair, which is coated on the surface of the fetus, which is present in the mother's womb. So later, it is shed off in the vernix caseosa or in liquor amni, and it is converted into lunago. Lunago is next converted into vellus hair. Vellus hair is also a thin hair. We usually find these baby hairs in the babies which are just born before the age of 3 months in babies. We find very thin hair. We call it as baby hair. So next is the terminal hair. That is the 3rd classification. That is the thick hair which we find on the scalp of an adult or the person who has reached puberty. There we can find the terminal hair. So in children, like when they are born, there will be shedding of the hair because of maternal hormones. Little bit of hair fall will be there in the newborns or in at 3rd month, 9th month, which will be naturally like they grow back. Whereas after that, in children, hair fall is very rare. Like if you give them good nutrition, if you give them good balanced diet, in spite of other illnesses or infections, we usually do not find a hair fall in children. Like even if there is hair fall, thinning does not happen. Thinning is mainly because of DHT hormone. That does not happen in children. But in spite of that, if it happens, we have wonderful drug in our repertory. Our masters have designed the repertory in such a manner that they help us when we deal with such cases. So falling out of hair in children, so we can find 6 remedies, that is Baritacar, Arundo, Calcarea fos, Mancinella, Natramute, Silicea. So in young people, very young, school-going girls, college-going boys, like rubric, head baldness, young people in, we can find it in medicines like Baritacar again, Lycopodium, Silicea, Calcarea floor, and tuberculin. Alopecia and pregnancy. So after delivery, postpartum, hair fall happens. As I told you, so it is known as telogen effluvium. Most of your hair goes into your resting phase, but in pregnancy, hair fall do not happen in general. First 3 months of your pregnancy, you might lose your hair, but from the 4th month of your pregnancy, nobody lose hair unless they are healthy. Because the hormonal balance is maintained in such a way that in pregnancy, your hair grows like very thick. You get a very lustrous hair, and it might also be because of good balanced diet which the person is having or the supplements. So in spite of that, if people lose hair in pregnancy, like there is only one medicine which is mentioned, that is lacasis. So like when there is single rubric, like it is a golden opportunity for us to prescribe. So when there is postpartum hair loss, that is after delivery. So this is very common. We can think about Lycopodium, sulfur, Calcarea, Cantharis, Carboveg, Natramure, nitric acid, Sepia, Calicarb, and these medicines. So in menopausal women, climacteric age group, postmenopausal women. So when there is hair loss, important medicines, Lycopodium, Sepia. So after diseases, we have encountered a lot of cases after COVID. So we can see under the rubric falling out of hair, head, falling out of hair, alopecia, diseases after Calcarea, Carboveg, China, Ferrum, Hepar, Lycopodium, Mancinella, again, Silicea, Thallium, Thallium met and Thallium self. We can consider this after acute illnesses, viral illnesses, COVID-19, all these things. So when the healthy hair is replaced by white hair, gray hair, white hair grows in spots, especially in alopecia areata. We find a lot of patients, when we treat them initially, the bald patches will be recovered with gray hairs initially. Then they will be replaced with terminal hair. So under these circumstances, you can think of Sorainum, we can think of Vinca minor. So in alopecia areata, that is falling out of hair in patches, in spots, we can think of fluoric acid, Heparcel, phosphorus. So there are other medicines like Epis, Ars, Calcarea, so on. So what is the rubric? Like we see like in scalp eruptions, especially eruptions moist, that is under destroying the hair, Calibi, Mercurius, Natramure, Staphysagria, Vinca minor, Rustox, all these things, Sorainum, we can think of that. Falling of hair from eyebrows. When we think about this, the main medicine that comes to our mind is selenium, right? Calicarb, selenium. So alopecia barbae, that is hair falls from mustache, beard, in patchy pattern or in diffuse pattern, we can think of Calicarb, again Agaricus, Calcarea, Graphitis, Natramure. Soreness, if there is soreness present in the area where hair loss has happened, you can think about Zincum. So the same things we can find under the rubric hair falling after exhausting diseases, grief, if there is greasiness, combing the hair when Cantharis, if the hair is very brittle, we can think of Sorainum, splitting of hair, lot of split ends. We can think of Borax and Tuja. So again, like the same things from eyelashes, like we can think of Epis, Ars, Bufo, Calcarea, Rustox, selenium. So what is the miasmatic diagnosis? So Hahnemann has mainly classified under three miasms, right? Sora, syphilis, and psychotic. So homeopathy with its holistic approach, like consider the patient as a whole, and so plays a very good role in treating psychosomatic disorders. Like when this hair fall is combined with psychological illnesses, homeopathy plays a very good role, because like homeopathy is based on nature's law of cure, and psychosomatic disorders are one of the most important causes for hair loss. In psora, like usually the skin or the scalp will be dry, rough, unhealthy, and discharges are very scanty. Whereas the lesions, there is a lot of irritation, there will be a lot of itching, inflammation due to hypersensitivity. Psychosis, there is infiltrations, indurations, overgrowth, pain may be very intense, discharges are purulent, fishy, there will be thickening. So in syphilitic, as we all know, like there will be granulation, degeneration, ulceration of the scalp. The discharges from the scalp will be offensive, foul, putrid. So eruptions are brownish red, copper colored, and tendency for easy ulcerations. So tubercular, that is pseudosora, it is mixed of psora and syphilis, right? So there will be a lot of tubercles, fibrosis, suppression will be there. There will be a lot of pain, neuralgic pains, purulent discharges, yellow, musty. Skin might be translucent, fine, smooth, with tendency to bruise and bleeding. So like we are going to discuss 2 cases today. So one is a case of telogen effluvium with mild postpartum depression. So a 32-year-old female, like especially in the era of like in COVID, like there were online consultation which was going on. So the patient husband is my friend. So they approached me initially for wife's hair loss. It was 7-month postpartum, it is not party. So she was 7 months postpartum. So we advised her like losing hair after like 3rd month of pregnancy up till 8th month of pregnancy is normal. Have a good diet, have your supplements. In spite of that, if hair fall is persisting, please revert back. So we counseled them. She was already on supplements. She was breastfeeding her baby. Now, after a month, the patient calls again. She complains with lot of distress. She's crying. So she complains there is lot of hair fall, like around 200 strands per day. There is thinning in the temporal and the vertex areas. So she's crying uncontrollably. In spite of like consolation, counseling, she's not helping. Like she's very much scared. She's very much anxious. Like she is like, I'm going bald. So especially in young women, like when there is lot of self-image issues, when hair fall is happening, like it is not life-threatening, right? In spite of that, they have psychological issues. They get scared. So here we need to handle the case like very carefully. So you cannot tell her losing hair is very like, it's not life-threatening. Come on, move on. We cannot tell them. It will be like a backstab on them. So feeling of sadness was there. On probing, she revealed she was under shock since she has delivered female baby, family members, and she had gender disappointment. So she was depressed, worn out, weak, inactive, apathetic. Occupies most of her day because like she was into completely baby care, lot of sleepless nights due to baby feeding care, no personal time. She desires for her self time, like for exercises, but which is not happening. And she feels she has gained a lot of weight after delivery, which is giving her a lot of sadness and which is giving her the symptoms of depression. So exclusively breastfed baby. Baby is full-term cesarean section delivered. Menses was normal before. Now only 1 cycle has happened at 7th month postpartum, which is very scanty. General's patient is thermally hot, thirsty, desires for pickles and sweets. Since she was devoid of salty and sweets food after delivery, perspiration normal. Everything was normal. Sleep was disturbed because kid was not leaving her to sleep. She felt better lying on the stomach. Habits is nil. Aversion, nothing specific. So I think we all can guess the medicine. That is mind ailment, shock from mind, consolation, aggravation, sympathy, aggravation, mind sadness, purpural, mind sentimental, mind beeping while telling sickness of others, head, hair falling, delivery after. So this is, we all can guess this medicine. Natramute, sepia, ignatia, pulsatilla, platina, sulfur. So we thought, okay, we'll give Natramute to her. So in spite of giving Natramute, that is 1 ml, 1 dose, and we put her on placebo for 6 months. So after 6 months, patient says hair fall is better, like around 10 strands, but it is persisting. Thinning was still there. So it is the second prescription where challenge happened. Like we find ourselves challenged, right? We give the medicines, we expect recovery, but it is not happening. It is happening up to a level, but not to the level we have considered. So sadness and apathy still persist. We have done counseling to her. like losing stance is normal, like, but mental should have disappeared, right? Like her sadness, her agony, like her depressive symptoms should have gone first, then the physical complaints. So we reconsidered the case. We advised a thyroid test and abnormal USG to consider any hormonal changes is there or any PCOD, ovarian cysts. So reverted back after a week. TSH was 5.5, like it was borderline normal. Desirable value is 2 to 3 according to the modern medicine during pregnancy and lactation, right? But her TSH was 5.5. So we reconsidered her case. There was a lot of feeling of weakness. She had desire for sweets, especially her family had given her a diet plan of postpartum. Like she has to eat food which is devoid of spicy, salt and sweets. So she felt better lying on abdomen. She desired sweets, especially like when she feels a lot of weaknesses there in her. So we found this medicine under the better lying on abdomen or reclining position, mind, melancholy, weeps. So there is a state of puffiness. There is a lot of weight gain after delivery, obesity. She feels tired. There is fatigue. She wants to lie down. Thyroid weakness causing decided craving for large quantities of sugar. So we considered all these symptoms. So we have put her on, we have second prescription, we put on her another medicine. So any guesses like considering these symptoms? Yes. So the medicine we put her on was thyroidinum 201 dose. So counseling was done. So we asked her to report after 6 weeks. So after 6 weeks, like she was very much better. As you can see in the pictures, there was a lot of thinning in the vertex areas, in the frontal area. So after this is almost 1 year, 2 months postpartum. So now hair fall is under control. She feels dynamic. The symptoms of sadness, depression is under control. We have done counseling also. Menses is also normal. She has commenced her normal menstrual cycles. So this is the potential of homeopathy. Like it appears as a simple case, but treating efficiently at time and giving self-confidence to the patient equally is important. So we'll move on to our next case. This is the second case of trichotillomania. So what is trichotillomania? The finding these cases in young people, children is very common, but in adults, it's very rare. So trichotillomania is also called as hair pulling disorder. It is a mental disorder that involves recurrent irresistible urges to pull out hair from your scalp, eyebrows, or other areas of the body, despite trying to stop. There is an uncontrollable urge, right? Hair pulling from the scalps often leaves bald patches, so which causes significant distress, and social and work functioning can also be very low. So the people of trichotillomania can go to any lengths to disguise their hair loss. They can do any variety of acts. For example, trichotillomania may be mild and generally manageable, but for some people, there will be compulsive urge. Some treatment options may have helped many people reduce their hair pulling or stop entirely. So we all know, like trichotillomania, there is cases of trichobizarres also, like they pull their hair, they swallow the hair, and there is a lot of hairball accumulation in the intestines. It finds very silly, but when it happens in real, like there is a lot of complications which we undergo. We have found in news and in media, right? Like a lot of people swallow their own hair. We found a hairball that is trichobizarre in the intestines. That is the after effects of trichotillomania. So it might also lead to intestinal obstruction and other complications. So this is Mr. X, like patient aged around 50, came to us with friend in 2011, November 20s. I was a fresher then. Complaint of scalp visibility. So the patient had the habit of plucking hair since 2 years. History of presenting complaints. The patient complains of scalp visibility with jigged, broken hairs, irregular in length. So how do we arrive to the conclusion? Like even people of alopecia areata, they have scalp visibility, whereas people of androgenetic alopecia also have scalp visibility. People of trichotillomania also have scalp visibility. How do we distinguish? In androgenetic alopecia, as I told you, people never lose hair just above the ears or in the back. Whereas in alopecia areata, we find exclamatory marks. In trichotillomania, there is jig broken hairs, irregular in length of the shaft of the hair, and complaints of the habit of plucking the hair. So there is vertex male pattern thinning. With trichotillomania, this person also had androgenetic alopecia. That is male pattern thinning. So this started 2 years back as a habit without realizing, and now he's focused and intentionally plucks the hairs from frontal and temporal areas. First, he was not conscious about it. Now he is doing it because he's deriving pleasure out of it. When probed further, it revealed that patient is experiencing marital problem, expected that wife is very dominant and abusive to him financially and verbally. So patient is a businessman. He has electronic business. Now he is not working. So because of his illnesses. So patient wife often complained him that he is not sufficient. He kept on abusing him in spite of his working daily, in spite of doing all his duty. As told by the patient, he has undergone a lot of suppression from his wife. In marital relation, lot of problem happens, right? But the way we react is the thing that gives the disorders or diseases.
How much time you needed, doctor?
Okay, sir. Time over, sir. Yes, sir.
We want a discussion, so please.
Yes, sir.
Conclude this. Yeah.
Yes, sir. Yes, sir. So, like, I will come at the conclusion. I'll show you the, like, we took ailments from anger, ailments from honor wounded. So he used to feel suffocated while going to high places, and there is fear, losing self-control, mind pulling hair, desire, general tampering. So considering all these symptoms, we put him on Stephysagria, 1 1 dose. So after a month, patient feels better. We have put him on a lot of back flower remedies, and we have done a lot of counseling to him. So this is the pictures where we can see. First, there was a lot of jig margins, which was irregular in pattern. He presented himself with a lot of androgenetic alopecia. And after 1.5 years of treatment, so when the habit of trichotillomania was broken, so we find himself with a good distribution of hair. So coming to last but not least important, so biotin, folate, and B12 plays an important role. So vitamin C, vitamin D, especially gooseberry, guava, kiwi, strawberry, citrus fruits, exposure to sunlight. If you're non-vegetarian, like fish, cod liver oil, egg, mushrooms, cheese, oranges, almonds, sunflowers, mangoes, kiwi, like these are the things. Even if found in traces, it is necessary to munch upon this to have a good hair and scalp health. So do's and don'ts, like these are very mechanical things which we can do. So milk, almonds, palak paneer, kabuli channa once a week, pear, papaya, tomato, any one of this daily, green tea, soya beans. So engaging in a de-stressing activity. So often coming to don'ts, do not use urdi dal. Often you can avoid red meat and red wine. Do not comb your hair when it is wet or blow dryer. Lukewarm water is suggestible. So these are the mechanical things which we can have for a good, healthy hair and scalp. Thank you, sir.
Well, a nice presentation. Totality is there. Really wonderful topic. Even though it looks not much important, but she exposed the depth of the topic. That's most important. It's time for discussion. Those who would like to participate, please go to participants and raise your hand. Yes, as I expected, the most enthusiastic person in this platform now is Dr. Amir Malik. Yes, Dr. Amir Malik from Pakistan. Yes, please raise your hand. Yes, Doctor. Yeah.
Honorable Sir, Namaskaram and good evening. And today, my special thanks to Honorable Dr. Chaitra AVINASH. Really, I appreciated the way you give the details of the hair treatment. I don't have the words. The words are not enough. Really, I appreciated a lot your lecture, your details, your approach, your research. I salute you for this, Honorable Doctor. I really appreciate it. I have to ask a lot of questions to you because as have you been explained the way, I have found that I want to say you are the encyclopedia of hair problems. You can solve. You are masters in the hair problems. You have a really very bright solutions. You have it, and you just give a grand experience to us. My kindly 2 questions I would like to ask. One, something the external use for the hair loss and of the eyebrow loss. One thing. Second, any medicine which we can use or oils externally to give the immediate support to the hairs. Can you give some idea on this? Can you highlight this, please? And again, special thanks to you with a lot of love and prayers. God bless you. God bless you.
Thank you so much for your kind words, sir. I am humbled. I'm a learning student, and at the same time, like external applications, we have not used much, sir. Like in cases of alopecia areata, we have seen like there are a lot of patients who come and tell us like, give me something external. I want to apply external. Like, but in spite of that, we have not given them. So I do not have much experience in external applications for trichological cases, sir. So we put them on internal medicines itself. We provide them counseling. So we provide them batch flower also, biochems also, but external application we have not used. Even for alopecia areata, sir, we tell them sunlight exposure is must, but other than that, no external applications, sir. So
What
even
about-
for premature hair graying, we find patients like they would have already
Okay,
taken
Dr.
Visida and Jabarandi in coconut oil. They would have done mixture and ask us, we want thick hair. Like we tell them like whatever has happened, like we need to correct it internally. So
Internally.
till now it is going on, sir. Like external.
Yes,
application.
Dr. Chaitra, Amir Malik is a specialist. He is always doing such experiments. He's a
Yes, sir.
MSc in biochemistry. He's a wonderful person, Dr. Amir Malik. Okay,
Yes,
Dr.
sir,
Amir Malik, now Dr. Rasa.
Yes, thank you very much, Honorable Sir. God bless you for the all prayers and things.
Yes,
I'm really thankful to you, sir.
yes, Dr. Rasa, please. Yeah.
Thank you.
Hello, sir. Hello, sir. Hello, mom. Thank you for your good lecture. For external users, in some patient, Arnica Montana had a good result. And I want to ask if you have any experience in the hair loss in psoriasis patches. Do you have any experience?
Yes, sir.
In that-
Psoriasis does not happen in patches, sir. Psoriasis is a diffuse thing that affects your scalp,
Yes.
right?
Yes.
Yes, sir. So it might
Yes, sir.
happen in discoid patches on your body. We call it as gutted psoriasis if it happens in patches. So when it comes to the scalp, like initially you might find it is in patches, but it is an inflammatory reaction, which is like we have good results in psoriasis, sir. When it is not only found in scalp, it is found on other parts of the body also. Like we have put them on, to be very frank, we put them on LM potencies, like higher potencies, so that we achieve cure very fast and in prescribed durations. Yes, sir, we have a lot of good results.
Which remedy you give?
But there might be relapses. Like we tell, like it is permanent. Once we cure in homeopathy, it is permanent. But in this 4G and 5G era, where there is a lot of stress, where diet is not happening properly, there might be cyclical relapse after 3 or 4 years. The same patient comes back to you. So we must be ready to treat them again for those cyclical relapses. Like theoretically, it should not happen if you have given that similimum. In spite of that, unfortunately, we have some patients who come back, but we are managing the relapses also, especially in psoriasis, sir.
Yes, sir. Which remedies?
Yes, sir.
Which remedies?
Which remedies, sir?
Yes.
Sir, we put them on constitutional approach only, sir, in psoriasis. If there is only like a thick, crusty, like we have some pointed drugs, no, sir, we need to elicit whether it is because of eczema of scalp or it is really psoriasis. Right, sir. If it is psoriasis is confirmed, we have medicines like sulfur, graphitis, petroleum, mesareum. We can think about, sir, but constitutional drug is the main thing which we need to prescribe in such cases, sir. Since it is a chronic inflammatory disorder, like we need to put them on constitutional approach.
Okay.
Thank you.
Yes, that was Dr. Rasa from Iran. Yes, thank you, Dr. Rasa. Now, Dr. Dhanesh. Dr. Dhanesh, please.
Good evening, all, and good evening, Dr. Chaitra. It's really one of the best performance from the doctors here, and you have shown beautifully homeopathy works in conditions like this, particularly the area of head, because head, where head fall, hair fall, everything is very, very important, because now a lot of people are more concentrating on cosmetology, and even a homeopathic doctor can become a cosmetologist with your homeopathic medicine. This is what the beauty of homeopathy, and your case demonstrated here was really an excellent one. It is an eye-opener to all that. Whatever be the cause, you just find out the cause behind the illness, then you will be able to go with the right remedy. And then if there is an obstacle, then you have to look into the case again and again. Then you got the remedy, thyroidinum, as an obstacle, because the thyroidinum, thyroid problem was the obstacle, and you got the right remedy, thyroidinum 200, that works in a beautiful way. And as a result, the homeopathy was able to bring the best result to the patient. And not only that, when a patient gets such a cure, definitely it will be spread like anything. And I must say it was a down-to-earth performance from you, Dr. Chaitra. I hope that you will come out back with one more presentation or some more presentation about the same or some other subject. We are waiting for that. Thank you, Dr. Chaitra, once again.
Thank you, Dr. Danish, for giving me this opportunity. I thank all the members of IHFP for providing me this opportunity again.
Yes.
Again, I would like to thank everybody. Even I thank all the audience.
Yes,
Thank you.
Dr. Chaitra, could you put your phone number in the chat box?
Yes, sir. Yes, sir. Yes, sir.
Now, some of our doctors are giving the same medicines along with some are applying our arnica tincture as external applicants also. They are also getting good result. Some last week, one doctor has shown the beauty of homeopathy through these applications along with the Vinca minor medicine like that. Anyway, thank you, doctor.
Yes, sir. Yes, sir. Thank you so much for giving me the opportunity once again, sir. Thank you. Yes, sir.
Definitely, there's an important aspect she exposed is that it gives a warning regarding the condition of the general healthy condition of the body. That is more important. Then another point is that we can prevent the conditions. That's also very important. I think on the homeopathic view, only through homeopathic medication, we can achieve all these things without endangering or causing damage to the patient. That is most important, especially when the patient is more concerned about the cosmetological aspect. When you apply a medicine that will give more disfigurement, definitely that will be much tragedy. There will be much tragedy. So wonderful presentation. Now I think Ahmad Hassan Shah is there to express sort of thanks from Saudi Arabia. Yes, one of our regular participants as a homeopathic lover. Sir, please.
Thank you, madam. On behalf of our IFPH, honorable sir, our senior doctors, as well as our participant, I express my heartily thanks for your very educative and simple and very meaningful presentation. May Almighty bless you. Thank you very much, sir. Thank you very much, madam.
Thank you,
Dr.
sir.
Danesh, what about our tomorrow's program?
Tomorrow we will have a session from Dr. Shaji Kudia. That will be one of the area where we are about to discuss about the science of homeopathy, because that is tomorrow is the National Science Day. I think International Science Day or something. So in connection with that, we are about to discuss about the science of homeopathy.
Yes, we all know that Dr. Shaji Kudia is the Vice President of IFPH, who is giving an international face always to this program and is working 24 hours for promoting homeopathy in a good way. Then Dr. Chaitra pointed another important these medicines or these are the pointers to a remedy. That's most important, because there is no mixing of the symptoms or no prejudice, but we can directly judge about the condition of the patient. So that is the importance of this science in homeopathy. Often the symptoms the patient described will have some hypocontacts are there. Then there are some persons, they are always not willing to talk with the psychotic background. So this is more important than the nail, the skin, the hair. Well, all these things, it's very important as far as homeopathy is concerned. Then regarding the diet and regimen, of course, we must follow the homeopathic diet and regimen. That's most important, because it should always consist some elements from the medicine we apply, then the disease, then the atmosphere. Everything is important when you select the diet and regimen for the patient. That is also very important. With that remarks, let me conclude today's English session. Hope you to meet the same day tomorrow. Till then, goodbye. And it is all Dr. Dhanesh for continuation program in Malayalam. Thank you.
Thank you, Dr. Manoj and Dr. Chaitra.